gonna be honest with you. Science is boring, but not here.
All right. So thank you for joining ClinArk Talks, man. My best friend, best man at my wedding, Mike Jones. Thank you for joining me. So what I'm trying to do with this show, with this talk show, is really give researchers, give community members a platform to just really talk about clinical trials, talk about research, their fears, have researchers come on and talk about, stuff that the community may not even know. So it's really just kind of creating that platform for people to exchange ideas in regards to science, and you know what I mean. But yeah, man, it's been a while since we got to interact face to face. COVID out here,
right?
COVID is out here making stuff tough, man. Making stuff real tough, man. So yeah, how's everything been?
Oh man, well, first off, my brother, thank you for allowing me to be on this platform. When you invited me, I was like, of course. Like, what? Like, yeah, man, let me, without question, bro. But, I got you, man. But
Absolutely.
As far as COVID, I've been maintaining.
Yeah.
Like me and Raven, we just been working. We're still, practicing, protocol, social distancing, wearing our mask everywhere we go, things like that. Although I've seen a ton of people, especially over the past couple months, man, they've been living too comfortably for me. I'm like, man, y'all going on flights and stuff, y'all going on the cities, other countries.
Mask. We just gonna breathe. We're just gonna breathe the fresh air and get everybody sick.
Fresh corona.
I mean, so people may not know. You work with kids and stuff. So how has that been like? In terms of working at the schools and stuff. How's that like? How is that? What has the day been like? Working at school in terms of COVID.
Well, for the past few weeks since school started, we've been going through what's called a distance learning model. So the kids been at home. Like they've been at home. Like we were trying to get the kids coming back, returning to school this past week, but we were in the red, Hamilton County. And so we pushed it back. This upcoming week, we're planning on we're going to have kids return. We're going to start with K through second grade this upcoming week. And then the following week, we'll have grades 3 through 6. So, and basically with the blended learning, we're going to transition to what's called a blended model. So you're going to have half the kids come on Tuesdays and Wednesdays, other half come Thursdays and Fridays, and then Monday will be all virtual. So, man, like it's going to be, it's twofold, because one is like, on one end, it's like, you're so glad to see the kids finally.
Right, absolutely.
We're so glad to see them. We're so glad to be in the presence of them. But on the other end, it's like, ooh, more humans in this building.
Whoa, increase my chances here. Hopefully,
woo, these little humans that carry germs, and I don't know where they've been over the past 7 months.
The nastiest situation here.
Yeah. Like I'm gonna give a whole bunch of air fist, elbow bumps. You know what I'm saying?
And for people that don't know, he lives in Cincinnati. That's just we forgot to mention that, but I'm gonna go ahead and get that out of the way. But yeah, man, I can only imagine. I can only imagine what that's gonna be like. I mean, it almost seems like a dangerous situation, to be honest with you.
And listen, I got rubber gloves in my work bag that I haven't used yet. Best believe on Tuesday, I will be having rubber gloves on, mask on, all that.
Man,
all that.
I honestly don't blame you. My wife's pregnant, man, and I mean, I'm kind of like the shield, man. I try to go out there and do some of the small things so she don't have to go out there. But
right.
It's a crazy situation for everybody, to be honest with you. I mean, I don't know.
Bro, it's nuts. Like when you think about this, like it is nuts. Like when you look at the surface of everything, like make sure you wash your hands, make sure you clean up after yourself. These are things that people should have been doing the whole time. Like even before this coronavirus done popped up out of nowhere, before this pandemic, folks should have been washing your hands. Folks should have been, using hand sanitizer, soap and water. Folks should have been making sure that they're properly hygienic. It's like, why do we have to wait to a pandemic?
Absolutely.
To affirm these things? It's been nuts, man.
Yeah, man. So, I have a couple. I'm gonna start with my first question. I guess so. We already talked about how essentially how COVID's impacted your life. I guess what I would like to ask you is like, what do you know? What I do. I'm a researcher. I work in clinical research, all that good stuff. What I'm trying to do is kind of break down the barrier between us minorities and research, because we have like this fear. You know what I mean? But what do you know about clinical trials? Like just from without even knowing me, people don't, we're friends, but what do you know? What have you, oh no, man.
Let me go Google real quick. Nah, but especially, well, first off, I've definitely gotten a better sense of it since you started ClinArk. Well, basically, like clinical research to me is basically you're researching different medicines, you're researching, different medicines to make sure that in the simplest of terms, make sure that it is healthy. Make sure that people are able to use these, medicines so that it could be approved, and make sure that these medicines are clinically approved, and to make sure that my bad, I'm tongue tied. But making sure that, research is being done on these new medicines that are being developed.
Right.
And making sure that they are safe enough that that these medicines are being put out in the market, and make sure that people have trust in these medicines.
Exactly. I think
basically just make sure that this research is done so that people can not only know what these new medicines are, but to make sure that we can trust these new medicines.
Now, would you say before I you've known me for what? How long have we known each other? Since we were like 13, 14?
Half our lives, man.
So before I got into the industry, would you say you didn't know anything? Like I personally didn't even know the industry existed for real. Like before I was 19 and I didn't know it was. I didn't know it was a thing. Would you?
Yeah, I didn't even know. Like I didn't even know this was a thing. Like clinical research, what in the world is that?
Right. That's how it was.
Like what is that? But before you got into this industry and stuff, I didn't have a clue what that was, man. I didn't have any idea whatsoever.
Yeah, man. I would, I think it's so weird, and I think that's a barrier that we have to get past, because we know what football is. We know what other. I'm just saying like
yeah.
We know what construction is. We know so we should understand like what the components of our field. And I think that's also a way to build trust, giving people access to what's actually happening behind the scenes,
Yeah.
So, funny question. Considering today's environment, what's going on right now, without getting too political, we're not gonna get political, but what do you know anybody? Do you know, just genuinely, truthfully, watching what's happening right now with the drug development, them making vaccines and all that good stuff? Do you know anybody that's in your family, whoever, that's sitting down like, man, I think I would try one.
It's funny you mentioned that because I was thinking last night, like, please do not make this political. Like, please do not give any response
I'm not
that make this too political.
Yeah,
Because I was saying this to myself last night, like, listen, he may ask you a question that may reference this administration.
Yeah, no, we not. That's why I said the environment. You know, this stuff that's happened. You know what?
You know, me and my mom had a conversation about it a few weeks ago. You know, she's watching the news and they was talking about vaccinations and this and that. And she asked me did I want to take it, and I immediately said no, absolutely not. Like, absolutely not. Like, and then you hear, like, you go on social media and then you see people have the same sentiments. Like, no, I don't want to take this vaccination. Like, for what? Especially, and this is the only political thing I'm gonna say, especially under the tutelage of this administration. Like, why should we? Not even just as Black people. Why should just we as a people trust this administration with this vaccination?
Yeah. Do you think it's safe to say, like, hearing about like how the speed at which it's being made, do you think that's playing a big role in it, or would you say, in terms of your feelings, like, would you say watching the speed is you know, the speed at which it's being created is a kind of a barrier for you, or is it like Tuskegee, you know, the experiment that happened with, you know what I mean? Which one would you lean towards? Like, which one is really like the main driving? Which one is driving your decision, or is it just a combination? Like, you know, I just don't.
It's a strong combination of those factors. Like, man, because when you look at like this pandemic and you see the effects of how many people it has unfortunately taken away, when they talk about, oh, well, we can have this we can have this vaccination done by the end of this year, you're like, what? Whoa, hold on, whoa. We do not need a microwave vaccination. We need to put this vaccination in the slow cooker. You need to make sure you have all the correct ingredients. You need to make sure everything is properly mixed. You need to make sure this is healthy for everybody.
That is a very, very good analogy. He said, I am not eating raw food.
I don't want a McDonald's fast food vaccination.
No, sir. No, sir.
I do not want this. I don't want a drive-through vaccination. No.
Absolutely, yeah. And I think, would you say, like, I mean, just from talking to family members, that they're along the same lines, like the same fears? I don't know anybody that you know my family. I don't know anybody that's like, man, I'll take it.
Yeah, I don't know anybody that's gonna be all jolly and volunteer to take this vaccination.
That's what I mean. I think, I guess from my perspective, it's like, I'm a researcher, and you know, I do understand the process.
Yeah.
But I do understand what it's like to be in the community shoes, you know, like watching it and hearing it on the news, and me knowing that it usually takes like, you know, 7 to 10 years to develop a drug, you know. So it's like, watching this is just like, man. I mean, it does feel fast, you know, and that's not to say that they don't have good intent behind it, you know. It's just like,
right.
It's just like me being on the outside looking in. I understand how the community could, you know, perceive it, because you are injecting it in my body, you know. And I think it's a lot. It's a hard pill to swallow for a lot of people. And I think, you know, I think the climate definitely does play a role. So I mean, so in terms of so I sent you a informed consent, and and just looking at it, just looking at it, it's a generic one. For the sponsors that may watch this, I didn't share any of top secret information. I promise. It's just a generic like informed consent. Based on like just reading that, and I know it's for children, whatever, but just based on reading that, do you understand what's happening? Like, do you feel like that like the terminology used, like somebody just that we know went to high school with will understand what was happening on that paper?
Even though it had a lot of medical terms that I had to go to Google to search, but but after reading a couple of times, I had gotten a general understanding of what it is.
Got you.
Basically,
go ahead.
I'm sorry. Basically, no, go ahead. Cause I'm pretty sure.
Go ahead. I'm listening to you.
Basically, what I got from it is we're trying to slow the progression of nearsightedness. Right. We're trying to basically, in the simplest of terms, make sure that our children have dang near perfect vision, right? Make sure that their vision is healthy. Make sure that they don't go through, situations where they can experience blindness, and things of that nature. So looking at that article, and it was kind of interesting that the FDA didn't approve it. and I'm reading and I'm just like, like these are three, in my eyes, three effective practices that have been done. Right. And the fact that there's a disconnect between those who've created these methods and the FDA, that's very troublesome.
Yeah. So imagine if that was like the paper that I sent you was like 20 pages, which they are sometimes 20 pages. Would you, like, as a patient, like, would that be overwhelming for you?
Yes. Yes.
I sent you a short one. Like, it's like a one page.
And that was overwhelming.
Really? Like, oh, man.
Like, I read the first paragraph and I saw some medical terms and I'm like, oh, I've never seen these words in my life. So that was like once I read it a total of 3 times, to be honest with you, just so I can get like the gist of it, just so I made sure I wasn't overthinking what I was reading. But yeah, like you said, like if you give a patient a 20-page form of consent saying, this is what we created, this is how I can help you. It may have some side effects, but that could be overwhelming.
Absolutely. Now, in our industry, one of the solutions that they say to kind of bridging that gap between research and minorities is bringing more minority doctors into the industry. So essentially ushering in more doctors from various walks of life. Yeah. Would you feel more comfortable receiving information from a Black doctor versus somebody who doesn't look like you? Like, how would that like make you feel? You know what I mean?
I feel like,
or do you not? You wouldn't care. You just trust him because he's a doctor.
Well, that's a good question. Me personally, I would rather have someone who looks like me be my physician. Because not only does that will make me feel comfortable seeing a Black person in that position, but he or she can relate to my body structure. Right. They understand, things that, as far as like diabetes and high blood pressure and things of that nature.
I have some sweet potato pies, you know what I mean?
Right.
Hey,
right.
Hey, man,
like they'll be able to relate to those conditions that have historically affected our community.
Right, absolutely. I mean, seriously, like in our culture, we eat differently, than other cultures. That just comes with the nature of life and where we grew up. I mean, Thanksgiving for me, in terms of diet was, everything was sweet. You know what I mean?
Right.
It was sweet, or had barbecue sauce on it. Some cheese, it was cheesy. Sweet tea. Fago. You know what I mean? Hey, I mean, you
listen, yeah. I mean, and
but it's
just
good.
like every black household,
that's our history. That's
where we come from. That's
yeah,
our culture.
It's
You know what I'm saying?
delicious.
Like that's our culture, you know. It is what it is. That's where we come from.
Right.
You know, that's like that stuff, soul food has been passed down.
Exactly.
You know, it's been passed down, you know, since our people have been in this country. So that's one thing that we're always gonna be able to pass down because it's a part of who we are as a people, you know. But at the same token, you know, it's good to have physicians, it's good to have doctors who look like you, who understand that, and be able to give you more insight as far as, you know, your health. So it definitely makes people, it would definitely make people more comfortable if they saw someone who looks like them. And not even just from race, even like gender. Like if I'm a woman, I would feel more comfortable having a woman doctor, you know, and you know what I mean? So it all those factors play a part. So.
Yeah, funny story. I remember when I was a kid, my pediatrician, she you know, woman, but you know, I hit 18 and she was just like, hey man, you know, we both came to a mutual agreement, like, you know, we got to break up. It was like, man, you're just too old. You know, I'm a guy. It's just like, you know.
Yeah.
That's a very good point that you make, man. I think I didn't even think of that, honestly. You know, the gender difference. I think that can really impact someone's decision, especially how many times I go to the doctor, because it's like, oh man, my doctor's a woman. I'm gonna just try to squeeze one out this year because I'm not trying to go all the time. You know, it feels awkward. You know,
and then, you know, she may explain some things that maybe won't click with you as much as you had a male doctor, and vice versa.
Right.
You know,
I got to bring it back to clinical trials because I forgot to ask you this question. So another thing that we like that we plan around in clinical trials is so like when we go to, like, we need to go to communities that say are underserved and, you know, poverty's high, all that stuff. One of the things that we have to think about is like transportation and all that stuff. So like, you know, I think one of the things that, like, you know, I haven't been there, you know, like not having a car, you know, having to walk with my groceries, having to, you know, like, you know, you know what I mean? Yeah, man, you know, so it's like, do you think that those are really important things to consider when developing these trials? Like, so like, man, we should make sure that we provide these people with transportation, you know what I'm saying, to the doctor's office, because maybe it's 20 minutes away. Do you think those are like, you know, things that should be considered in communities like where we're from?
Absolutely. Absolutely, because like you said, like especially like in the inner city, like you have a lot of people who don't have reliable transportation, who depend on the metro system, who depend on, you know, Lyfts and Ubers and things like that. If you have a system in place where you can have, you know, vans come, you know, or transportation that can take people to their doctor's appointments and take people to learn more about clinical trials and things like that, like it will spark up the interest and also come to the people. You know what I mean? Like, I think the one thing that'll get a person to get someone on your side is to not only, you could talk about it, but if you're there to show them, like go into the communities, you know, set up, have like rallies and things like that, clinical trial rallies and things like that. You know, invite the people, you know, to come and be able to learn about more research. That'll get them engaged.
Right. Because, and that's part of our culture. To be honest with you, that's how we celebrate. You know, that's how we come together, like gathering. We cook food. We you know, we have stands. You know what I mean? Like that's how you interact with the community. And you made a really good point. That's actually what I'm, you know, working on with my platform, to be honest with you. But no, that's a really good point. That's what I'm actually trying to get the industry to see. Is like, if we're gonna build the trust, we need to have conversations like this. They need to, you know, these conversations are important, but they also need to see us in the communities. You know what I mean? Like, they need to see that you can't show up with a suit on, and like they need to see you. You know what I mean? They need to see that you're a person, be able to ask you questions, talk about basketball, whatever. You know what I mean?
Yeah.
I think that's important.
And I also want to tie that. And it's interesting that I'm in education and you are in the medical field. And I think to tie the two together, because, I work with the next generation. If they see you going into the school that I work at, going into Fairview or going into your alma mater, like you go to a Withrow or Woodward, if they see you, then their curiosity will automatically trigger and be like,
I never saw that.
Like, I never saw someone who looked like me and talk about this type of profession.
Right.
Let me do some research. Let me spark your interest, and especially in the fields of math and science.
Yep.
We definitely need more young people of color embarking in those fields.
Absolutely.
You know what I mean? So yeah, like it's great that we're having this conversation because we can collaborate and go into these schools and talk to these young people, talk to these teenagers who are inspiring, or even if they don't even know what they want to do, just give them an idea.
Right. And what I'm trying to do with my platform is create it in such a way. Well, I've created it in a way that we can bring on community members and have them actually work as engagement specialists. So, kind of give them general understanding of what a clinical trial is, allow them to engage the community. But that's a way for people to get their foot in the door, to understand if I like this or not. Like if I want to pursue something like this, I think it's all about giving people the opportunity to experience stuff, man. Because I would never forget when I got to do, I did a job shadow when we were in high school at P&G. And I got the job, work with the scientists, learn how to make diapers. I ain't even, they had me making Pringles, all kinds of stuff. But I learned a lot. Like I learned what I didn't care about. and I learned what I like, I like the chemistry side of the operation. Not so much the diapers, you know what I mean? Right. But it's I think it's about giving people, even as adults, giving people the opportunity to experience stuff. Because you can be an adult and not know what you like yet. You know what I mean? So it's like,
oh, that's true. Like age is literally nothing but a number. Like it doesn't matter how old you are, you can always learn new things and always be able to put your foot through new doors.
Absolutely, man, absolutely. Well, this has been a great one. This has been a very good one.
I said, that's it.
I didn't want to run too long. I know we both got lives. You got to go, deal with children and all that good stuff, man. And my wife's in the other room, pregnant. She's probably listening to me like, man, what is he doing?
What is he doing? Get out of there.
I would find another place to do this, but with COVID, I got to do these videos. I got to do these talks from home. So,
and this is our reality now. Like Zoom, Google Meet, like this is our reality.
ClinArk Talks from the laundry room.
Like this is our reality now, man. Like this is how we're gonna be communicating in the future. We are essentially robots now.
Absolutely, man.
We are essentially robots.
100%, man. Well, man, it's been real, man. I really do appreciate you joining, man. And the insight that you've given me has been extremely valuable. I think the industry is going to love it. I'm going to, we'll share this around so people can watch it and see what it's like, from a community member's perspective, and just, being in the communities, dealing with children, all that stuff. I mean, these are things that if you're working on a clinical trial, you should be thinking about, man. But I can't thank you enough for your perspective, and I appreciate it, man.
Oh man, thank you once again, my brother, for giving me the opportunity to be on this platform, man. I've supported you since day one, man. You already know how proud I am of you, man. Like, and for you to be able to take on this task of giving this information to people, doing this research, putting yourself out there, to make clinical research a more open space for people like us, people from our background, people who came from the communities that we come from, to be able to give them an opportunity to look at this stuff and to give them an interest. And I appreciate you for that, man. And like I said, like whatever you need me for as far as continuing to grow your vision with ClinArk, man, I'm here for you, man. And I'm excited.
I'll take you up on that, man. Well, don't worry, I'm gonna take you up.
Since you offering,
after this video, I got you.
But yeah, man, like I said, man, not to get too long with it, but yeah, man, like I'm proud of you, man. Like I said, like I've always paid attention. Like you've given me a better appreciation for this. Especially since we're getting older and stuff, man. And it's important that we look at these things and take them seriously.
Thank you. You about to make me tear up over here, man. Maybe you're sweating now.
It's tough for them, man up. Ain't no tears over here. But man, thank you once again, man. And everybody, please support my brother, man. Support ClinArk, man. Support clinical research.